Hi, my name is Molly Vetter-Smith with University of Missouri Extension. I'm going to talk a little bit about the changes to Medicare as a result of the new health care law, also known as Obamacare or the Affordable Care Act. There are not major changes to Medicare, however, there are a few changes that Medicare recipients should know about. First being, there are several new free preventative services. Free preventative services means there's no copay at the time of the visit, and you will not get billed later for those services. Also, there's been some changes to Medicare Part D, also known as the Medicare donut hole, and we'll cover those in detail in a little bit. So there's better coordinated health care by providers or doctors, and there are some increased costs for higher income Medicare Part B enrollees that we'll talk about in a little bit. All right, let's talk about which healthcare services are now free of charge. First of all, vaccines, including flu, hepatitis B, and pneumonia, are free. Cancer screenings and other health screenings are free. Yearly wellness visits, such as physicals and your well woman exams, are free. Your initial Welcome to Medicare visit is free. Also, tobacco cessation counseling is free, alcohol misuse counseling is free, diabetes self-management training, and obesity screening and counseling are all now free of charge. The other major change to Medicare is a change in the Part D prescription drug gap, known as the donut hole. The donut hole is where someone reaches their Medicare prescription drug coverage limit, which in 2013 was about $3,000 in total retail cost of the drugs. It used to be that when someone reached their limit, which this year's $3,000, they then had to pay the full cost of prescription drugs until they had spent about $5,000 out of pocket. And that's when they called it the donut hole, because you have no coverage whatsoever and you're having to cover the full cost of the prescription drugs. After someone had spent $5,000 on out of pocket on prescription drugs in the donut hole, they would then go into what is called catastrophic coverage. That is where the consumer was responsible for only 25% of the costs, and Medicare or the pharmaceutical company would pick up the other 75%. What the Affordable Care Act is changing is that they are slowly phasing out this donut hole, starting in 2011, and it will be completely phased out by 2020. Now, when we look at brand name drugs, currently in 2013 and beyond, pharmaceutical companies will pay 50% of the cost in the donut hole. Now, Medicare is slowly increasing the amount that they are paying in the donut hole up to 25% in 2020. So in 2020, pharmaceutical company will pay 50%, Medicare will pay 25%, and the consumer will only be responsible for 25%. That is the same as catastrophic coverage now, and that's why they're saying it is phased out by 2020. Now, with generic drugs, Medicare currently pays in 2013 21%, and the consumer has to pay 79% in the donut hole. By 2020, the consumer will only be responsible for 25%, and Medicare will cover 75%. Again, the same as what catastrophic coverage is now. And so that is why we say the donut hole will be phased out in 2020. There will be no longer a period where the person is responsible for a large portion of the cost of the prescription drugs. Thanks for tuning in, and if you have any other questions about the changes to Medicare from the Affordable Care Act, please contact your local University of Missouri Extension office.